Hello, everyone, and welcome to today's webinar. We're gonna give another minute or two here for people to arrive, and we'll be starting momentarily. Thank you. Hello, everyone, and welcome to today's Model Aquatic Health Code Network webinar. My name is Daisy Galan. I am a Senior Program Analyst at the National Association of County and City Health Officials, NACHO. And today, together with my NACHO colleague, Emily DeAngelo, will be moderating today's webinar. As we celebrate the beginning of Healthy and Safe Swimming Week, today's topic is about ensuring aquatic health in your community. This webinar is being recorded and will be shared along with the presentation slides following today's event. Throughout the session, please feel free to interact with us and our panelists via the chat box and also submit questions using our Q&A box. We will address all your questions at our Q&A portion at the end of today's webinar. Next slide, please. Our first speaker today will be Samaria Luco. Samaria is the Oak Ridge Institute for Science and Education ORISE Fellow with the Healthy Swimming and Mod Aquatic Health Code. She has a bachelor's degree in biological science with an emphasis in global health from the University of Georgia and a master's of public health degree in epidemiology from Tempe University. Prior to joining the Healthy Swimming program, Samaria served in the Georgia Department of Public Health's COVID-19 response. Our next speaker will be Dewey Case. Dewey serves as the technical director for the Council for the Mod Aquatic Health Code. Working in the aquatics industry for over 20 years, he has served the YMCA of the USA, as well as the local and state chapters of the American Red Cross by providing expertise in aquatics. Prior to his current role at the CMAHC, Dewey served on the first and third editions of the MAC in a volunteer role. He was recognized as a self-proclaimed aquatics lifer by the Aquatics International in 2018 Power Issue, holding multiple instructor training certifications from the American Red Cross, as well as instructor credentials with the Pool and Hot Tub Alliance. He enjoys helping other aquatic facilities improve operations and helping young aquatic professionals hone and develop their craft. In addition to his service at the CMAC, Dewey also served as the Association Aquatics Director for the Family YMCA of Southeast Mississippi. He resides with his wife, Lisa, also in Mississippi. So with that, I will turn it over to our Commander Joe Lako from CDC's National Center for Environmental Health for some announcements and updates before turning over to our speakers.
Thanks, Daisy. And thank you to everybody who is joining us today. This is a healthy and safe swimming week for CDC. This weekend's Memorial Day weekend. It's the unofficial start to summer, the unofficial start to swim season. I live here in Georgia, and we've already had our pools open for a couple weeks now. So those of you in more northern climates, you'll be probably kicking off very soon after this weekend. To talk a little bit more about Healthy and Safe Swimming Week, Samaria is going to kick things off for us, and I'll turn it over to her.
Okay. Hello, everyone. I'm very excited to be here. I'm Samaria Luco, and as you guys already are aware of, I'm an ORISE Fellow with Healthy and Safe Swimming and the Model Aquatic Health Code. So today I will be covering Healthy and Safe Swimming Week and our recent MMWR report on outbreaks that are associated with treated recreational water in the United States from 2015 to 2019. We can go to the next slide. Okay, so the 17th annual Healthy and Safe Swimming Week starts today, and it goes to the 30th. And we have plenty of new and updated resources that are listed here that are available to spread the message for a healthy and safe swim season. So this week was designed to highlight the roles that swimmers, caregivers of young swimmers, aquatic staff, residential pool owners, and public health officials play in preventing outbreaks associated with swimming, drowning, and pool chemical injuries. And as more swimmers return to the water this year, we encourage operators of pools, of public pools, water playgrounds, owners of residential pools, and as well as swimmers and their caregivers of young swimmers to take steps to prevent germs from spreading through the water. And our newest resource is the Morbidity and Mortality Weekly Report that was released on Friday, and I will be discussing our findings shortly. And we can go to the next slide. Okay. And if you go to the CDC's Healthy and Safe Swimming Week page, you'll be provided with a multitude of options that have recently been updated to help public health professionals promote this week's messages. And this includes our updated campaign webpage, fun gifts for social media, infographics, features, and links to toolkits. And please feel free to download these and print them to promote healthy and safe swimming in your community. Next slide. Okay, and the current features, they address diarrhea and swimming. And outbreaks of diarrhea are the most frequently reported among recreational water-associated outbreaks. And the germs that cause diarrhea, they're spread when someone with infectious diarrhea swims in recreational water with others. And then while these resources that are playing across the screen are only a glimpse of the communication channels available to you, you'll find posters by topic, press release templates, fact sheets, and more with a deeper search of the Healthy and Safe Swimming website. Next slide. Outbreaks that are associated with treated recreational water can be caused by pathogens or chemicals and involve pools, hot tubs, or water playgrounds. The leading etiologies are Cryptosporidium or crypto and Legionella. So most pathogens are typically inactivated within minutes with free available chlorine, but crypto is extremely tolerant to chlorine and it can survive in the water for more than a week when its oocysts are ingested. This causes cryptosporidiosis, a gastrointestinal illness. And then with Legionella, it causes Legionnaire's disease, which is a severe pneumonia, or Pontiac fever, which is just a milder illness with flu-like symptoms. And then with Legionella, it's transmitted when contaminated aerosolized water droplets, like those produced by hot tub jets when they're inhaled. And even though Legionella is susceptible to chlorine, it can survive in properly chlorinated water for when it's protected by biofilm. Next slide. So for our report, we define an outbreak as the occurrence of a similar illness in 2 or more persons, epidemiologically linked by location and time of exposure to either 1, a treated recreational water, such as pools, hot tubs, spas, or water playgrounds, or 2, pathogens or chemicals that were aerosolized or volatilized into the air from treated recreational water. and where the first illness occurred in 2015 to 2019. In all outbreaks, they were reported voluntarily to CDC via the National Outbreak Reporting System, or NORS, by February 4th of 2021. And then for our variables, we analyzed data on earliest illness onset date, case count, hospitalizations and death counts, etiology, the outbreak exposure settings like hotels, and venue, such as pools, hot tubs, or water playgrounds. Next slide, please. So for 2015 to 2019, public health officials in 36 states and the District of Columbia reported 208 outbreaks linked to pools, hot tubs, or water playgrounds. And we found that 1 in 3 outbreaks were linked to hotels, and these include motels, lodges, inns, and resorts. And then these outbreaks resulted in at least 3,646 cases, 286 hospitalizations, and 13 deaths. Next slide. Okay, so starting with etiology, we listed our most frequently reported ones. And looking at the table, specifically at the second column, 3/4 of all outbreaks were caused by identified etiologies. And then 20 of those with an unidentified etiology were suspected to be caused by chemical etiologies. And these includes those like excess chlorine, 1 or more disinfection byproducts, or altered pool chemistry. And then we also see that crypto and Legionella were the leading causes of outbreaks. And crypto caused over 1/3 of the outbreaks and resulted in almost 2,500 cases. And then with Legionella, it caused about 1/3 of the outbreaks. And many of these were associated with hot tubs and resulted in all 13 of the deaths that were reported. And then when we compare crypto and Legionella, we see that they are close in the number of outbreaks, but due to its chlorine tolerance, crypto outbreaks can just be much greater in magnitude. And if you look at the last column, you can see that a single crypto outbreak accounted for 638 cases. The next slide, please. Okay, so then here we compare the number of reported outbreaks by etiology and month, and we saw 2 distinct patterns. For crypto, it's represented here with the dark blue bars. It was associated with pools, and it coincides with the summer swim season, which is from June to August, where over half of the outbreaks started. And then we also noticed that Legionella, represented here with the orange bars, is associated with hot tubs in hotels, motels, lodges, inns, or resorts, and it also this one occurs year-round. Next slide, please. And then here we compare the number of outbreaks by etiology and year, and found that half of the outbreaks caused by crypto, which is also again shown in dark blue, it occurred in 2016, where we had both community-wide and water park outbreaks occurring. And then we found that 13% of all outbreaks occurred in 2019, and closeout of 2018 and 2019 data occurred in 2020. And this is while public health was responding to the COVID-19 pandemic. And this leads me to our limitation. Next slide, please. Thank you. So the outbreak counts that are presented are likely an underestimate of actual incidents. We had many factors that affected the detection and the investigation and reporting of outbreaks, such as the voluntary reporting by the US jurisdictions. And we're also well aware of how resource and time intensive the public health response to the COVID-19 pandemic has been. And it could have been an additional barrier to 2020 efforts to finalize data on outbreaks occurring during 2018 to 2019. And an example of a barrier to detection and reporting is lengthy incubation periods, such as with crypto, which can be 7 or more days. Then also, we found that data might be skewed to include outbreaks of notifiable diseases, such as the ones you hear today, crypto or Legionnaire's disease, and they are reported to and investigated by public health. And then finally, our data on outbreaks with a chemical etiology, they might be limited because of the potentially transient nature of chemical contamination and the disconnect between those who report these outbreaks, such as a hazmat team, and those who report them, like epidemiologists. And then finally, data on factors contributing to the outbreaks, they were limited because they could not be analyzed, but revisions to the corresponding national outbreak reporting system, the data fields are underway to improve data quality. You can go, thank you. So for our discussion, almost all the outbreaks were associated with public pools, hot tubs, or water playgrounds. And then to prevent these outbreaks, the aquatic sector in the US jurisdictions can voluntarily adopt the Model Aquatic Health Code. So particularly for inactivating oocysts, the 2018 MAC recommends hypochlorination when responding to diarrheal incidents. And these diarrheal incidents are high-risk crypto-contamination events. So to follow these recommendations, this would mean raising the free available chlorine to 20 ppm for 12.75 hours, or to 20 ppm of free available chlorine for 28 hours in the presence of 15 ppm or less cyanuric acid. And then our other disinfection methods, such as ultraviolet light or ozone, have also been found to be effective in activating oocysts. And then the MAC recommends using these methods to achieve a minimum 3 log-base 10 reduction of infectious oocysts in water playgrounds, and then a minimum 2 log-base 10 reduction in all other aquatic venues. And then the aquatic sector and public health can encourage swimmers and caregivers of young swimmers to voluntarily adopt the CDC's healthy swimming steps, such as the don't swim or let your kids swim if sick with diarrhea. And the public also can check inspection scores, which are available online and on site. And in addition to that, they can conduct their own mini inspections before getting into the water by measuring the bromine or the chlorine level and pH with test strips, which are available at most superstores, hardware stores, and pool supply stores. And then individuals that are at an increased risk for Legionnaire's disease might just choose to avoid hot tubs altogether for their safety. But these and other healthy swimming steps have been posted with the resources mentioned earlier, so you can continue to go through that for more information. Next slide, please. The aquatic sector in US jurisdictions can also implement recommendations from the CDC's Legionella Control Toolkit and the Water Management Program Toolkit, where hot tub specific recommendations are included. With the Water Management Program Toolkit specifically, it even includes a quick yes/no worksheet to determine if an entire building or parts of it are at an increased risk for growing and spreading Legionella. And it also includes scenarios that describe common water quality problems and examples of how to respond to them to reduce the risk for Legionella. And then, since Legionella can amplify through many reasons, such as when disinfectant concentration does not properly maintain, when sediment or biofilm is present, when water is not replaced frequently enough, or when temperatures are favorable. And this is between 77 to 113 degrees Fahrenheit. Those are the conditions. And then since hot tubs operate in this range, maintaining the minimum disinfectant concentrations, conducting the daily inspection for and removal of biofilm, and then frequently replacing the water, they're critical for Legionella control. And the images are on the side so you can recognize this easily, and the links are included as well. Next slide, please. And then as for the 2021 MAC, we are currently updating the 4th edition after receiving more than 530 change requests. And just to give you an idea of how demanding this edition has been, there were only about 180 change requests for the 3rd edition. So our load has basically tripled, but it's on track to be released by CDC later this year. And then some of the proposed revisions to the code, they include a new guidance for filtration removal of Cryptosporidium oocysts, and then having this section on filtration as a validated method of crypto removal, it will promote the the use and development of high efficiency filters to protect swimmers. And then another proposed revision that we had addressed cyanuric acid, which has been a very hot topic in aquatics. One in particular suggested changing the minimum required testing frequency for cyanuric acid to a weekly basis. And then to continue on the topic of cyanuric acid, we can go to the next slide. Thank you. So cyanuric acid, or CYA, can be added to the water in outdoor pools to basically slow down the degradation of free available chlorine by the sun's ultraviolet light. And it does this by bonding with free available chlorine, but consequently, it increases the inactivation times of crypto and other pathogens. So in the next edition of the MAC, one revision did suggest adding response curves showing the impact of CYA concentrations on hypochlorous acid concentrations to operator training courses. And if you didn't know that hypochlorous acid is the primary sanitizer when chlorine disinfection systems are used in recreational water settings. So this change, including the response curves, will improve operators' understanding of how CYA affects disinfection when using chlorine disinfection systems. But of course, further research into cyanuric acid is still needed, so we can expect to see it again, addressed again in future MAC updates. And then next slide, thank you. And of course, I would like to give a special thanks to the state, DC, and local waterborne disease coordinators, epidemiologists, environmental health practitioners, microbiologists, and my CDC collaborators listed. And then next slide. And then here are the many links to our resources available to healthy and safe swimming. I highly encourage you all to check them out. Great material there, definitely during this time. And then, thank you. And then that's all. Thank you all for your time. And also, again, I've included some more links to healthy swimming topics and recreational water venues.
Great. Thank you, Samaria. So as introduced earlier, I'm Dewey Case. I'm the technical director for CMAHC. Just wanted to pop on for a few minutes and talk about our state designee committee. This committee is composed of health professionals, public health professionals from most of the states, and especially those that run pool programs. We've had this committee on the books for a while, but we have, over the last year and a half, refocused to where we are working on having regular meetings and regular communications. When we talk about the State Designee Committee, this serves one primary function, and that is to be able to disseminate information from CDC and CMAHC down to the state level in an effective manner, as well as even going down to, from the state designee folks down to the county and local public health officials. So as we have these discussions, we talk about lessons learned and best practices. We do a lot of peer network and peer interactions and peer Q&As, and feedback from this group has been very, very helpful in how we work at CMAHC, providing insight to CDC, and most importantly, it's helpful for each other. We convene regularly to talk about perspectives in aquatic health and public health, and certainly provide significant impact onto the MAC and MAC interpretations, et cetera. We do, as I mentioned, we do have these for all 50 states. We do have a few vacancies. So if anyone here is from Arizona, Delaware, Hawaii, Kentucky, Mississippi, Wyoming, or Puerto Rico or Guam, we would love to have a conversation with you about joining the State Designee Committee. Even if your state doesn't have a pool program, example being Mississippi, we would still love to have representation. As we work through this committee, one thing that we do focus on is support and support for adoption and also changes to the local health code. So even if your state doesn't have a pool program, we would love to have you participating to where we can work with you on improving aquatic health in your state and jurisdictions, as well as working towards adoption of a code or even revising these codes. Samaria did a great job talking about the MAC 4th edition, so I won't add anything to her excellent description. I will say that we are also working on the MAC Annex to where that is updated at roughly the same time. Our focus for the Annex right now is just on the CRs that were passed for this revision. And then at a future time, we're going to reconvene and discuss the overall Annex, streamlining and providing additional information where it may be needed. So that is in a future context. One thing I definitely want to mention is at CMAHC, one of our big roles is obviously supporting the MAC efforts to maintain the MAC and update the MAC. But something else we do is advocacy, right? Where we help others with updating their codes. We help others through the MAC adoption process, and also providing technical support to not only our state designees, but the entire industry and individuals at the local and county levels as well. So if you ever have any questions or need additional support, please feel free to reach out to us at CMAHC. You can email me, DEWEYCASE@cmac.org, or take the easy route and email cmac@cmac.org. And then one of us will definitely get back with you and provide whatever support that may be. Examples of support we provide are technical interpretations of the MAC and related guidance. We also will be more than happy to speak with you about MAC adoption and either in whole or in part, as well as just provide assistance to you with your local code as well, whether it's guiding you through the update process or helping answer some questions on priorities that may exist in your adoption efforts. All of those things are there for you to do and take advantage of. And I also want to say that our technical support services are 100% free. There is no charge for that. So feel free to reach out to us anytime you have a question. I want to thank the prior presenters, Joe and Samaria, for doing their wonderful work. And I also want to pause and thank all of you from your public health positions. And I mention this very regularly to the State Designee Committee. But all of you in the public health world have had an exceptionally difficult year and a half. And you may not be hearing it very often, but I want you to hear it from us at CMAHC that we appreciate your efforts in responding to the COVID-19 pandemic. And we especially appreciate your efforts in working diligently to make sure that people in your community are safe and healthy when they visit these aquatic venues. With that being said, I'm going to turn it back over to Daisy.
Thank you so much, Dewey, and thank you for Joe and Samaria for your great presentations. Very, very interesting topics. And we'll now move to our Q&A portion of our webinar. So as a reminder for everyone, please use our Q&A box to submit any questions you might have to our panelists. And with that, I will turn it over to Emily so that we can start with our first question.
Thanks, Daisy, and thank you to all of our presenters today. My first question is for CDC. I really enjoyed seeing the communications materials you've included in your presentation. I'm sure there's a lot more behind the scenes of the links you've shared. And I was wondering if there are any recommendations for how pool operators and venues can distribute this information. Do you find that posting these on site works best, or communicating these digitally or virtually? Is there a preferred method that you would recommend?
So this is Michelle at CDC. We don't have a preferred method. I guess our preferred method is whatever works. I think that might vary with different groups. Maybe with younger people, putting something on social media might work better versus, you know, with older swimmers or whatever, they want something in their hand, they want something printed. I wish we had a budget to print more things, but one request that we do make to our state and local public health partners, as well as to the aquatics sector, is that, you know, if you feel the need to create a poster and or have a need and your need for communications isn't met by what we have available on the Healthy Swimming website, please let us know, because if you need it, someone else will likely need it. I know that's how we started building out our communications materials for untreated recreational water so for our lakes. It was people had interest in getting something out about, you know, healthy swimming in lakes. But, you know, if you have something specific to pools or specific to crypto, please let us know.
Thank you, Michelle. So our next question is related to pool reopenings. And as we know, some establishments have been closed for over a year now. Maybe they didn't open last year. So has different jurisdictions or different places are thinking about reopening. Do you have any tips or recommendations? And where would you guide people to find resource related to reopening pools, hot tubs, spas after being closed for a longer period of time?
So I guess it's Michelle again. I think you know, this issue came up last year with the COVID pandemic when it was in much higher gear. And when I think swimming and I think, you know, extended shutdowns and not being able to operate or disinfect the water or maintain disinfectant level or concentration, I think Legionella and how do we prevent outbreaks caused by Legionella. But buildings as a whole have lots of issues, such as mold and you know, copper and lead leaking into drinking water systems and whatnot. So CDC has a website, has a webpage, excuse me, on the COVID website on how to reopen as safely as possible, given issues like Legionella, given issues like copper, lead, and mold. Joe, did you want to weigh in?
Sorry, I was on mute. Yeah, I was thinking the same thing, particularly with Legionella and hot tubs. In addition to some reopening guidelines, as Samaria mentioned in her presentation, there's some Legionella toolkits available, particularly on maintenance and management after an outbreak. You can use some of those same principles for your reopening to help ensure that they are in top shape and clean and disinfected so that they'll be safe to use. Particularly if there's been waters and pipes that's been stagnant for quite some time, in addition to, you know, flushing out the systems, actually getting in there and scrubbing any of the visible biofilm that you have access to.
Thank you, Michelle and Joe. This question may be a little hard to answer. It's more of a prediction, and I'd love to hear what you all think. I know maybe not specifically for Legionella, but for some of the other illnesses and outbreaks that we've seen through, or that you all have seen through your research, is there an assumption that perhaps increased cleaning and disinfection from, you know, being in this pandemic, that this will carry over and positively affect cases of outbreaks from treated pool venues?
Wow, Emily, you put us on the spot there. I'll have to get my magic 8-ball out. But anytime that we do preventative measures, such as increased frequency of cleaning and disinfection, it's going to have a positive outcome. Whether or not people to continue to clean more frequently than they had in the past, I think is yet to be seen. But just like mask, there are still people that are continuing to wear their mask, even though that they are vaccinated. And I think that's going to have a positive impact on reducing transmission, just like we saw with flu cases this past winter.
Yeah, I would agree with. Oh, sorry. Go ahead, Joe.
I was just going to ask if you had anything you wanted to add there on a bold prediction.
So I think, like you said, Joe, anytime you have a chance to get out and amplify your messages about, you know, health promoting behaviors, whether specific to COVID or just in general, I think it's a great opportunity to, you know, promote good health. Like, for example, with hand washing, I think is no different. I mean, we were all into hand washing or have been or getting more into hand washing, and so, you know, maybe we will see enteric illness, for example, drop off. I mean, we did see decrease in reporting to CDC for cases of illness as well as outbreaks. Some of that is going to be because people are at home and they're not interacting with others. Some of it's going to be, you know, our state and local public health partners had to prioritize response to COVID. And part of it might be just we're better at washing our hands, or we're better at cleaning and disinfecting, or whatever it might be. It'll be interesting to see how things evolve.
Great. Thank you so much, Joe and Michelle. The next question here in our Q&A box is asking about the data that was used for the MMWR. I know you focus on infectious disease, but do you include anything related to water rides in amusement parks, or is there access at the data maybe for the future?
So we don't, I don't even know that that's even an option to report like a water amusement ride. I'm not sure where you would report that, actually. I'm not sure that it would fit into a treated recreational water outbreak. I'm not aware that we specifically have that as an option. I do think CDC can do a better job, and we are trying in updating the National Outbreak Reporting System of making it easier and less of a burden on our state partners to report outbreaks. I know there were, I don't know how many fields there are in the National Outbreak Reporting System for treated recreational water illness outbreaks and other outbreaks. But I know I can speak for both treated and untreated recreational water. We were really slashing and burning and really trying to trim it down. I mean, as an epidemiologist, I'd rather our state and local partners report really consistently on 10, 15, you know, parameters of an outbreak, as opposed to asking for 100 of them and not getting really complete data on anything. So that is a push we're trying to make, and that's also part of the data modernization initiative to kind of make it easier for our state partners to report to us as well. One thing we have done, and this question has come up multiple times for this webinar and with other webinars that we do with our state partners is what was the water quality like when the exposures occurred? And so we've really tried to make it much easier for our state and local partners to tell us if cyanuric acid was in the water, if what the chlorine level was, you know, at the time of exposure, or testing soon after on identification of the outbreak. So we are hoping by collecting these data, we can start, you know, better supporting how the MAC prevents outbreaks and just better answer our state and local partners' questions. So this is, I think, has been at least a 2-year process to update the NORS system for reporting, and it's still not done yet, but I do hope it is a better product for our state and local partners.
Thank you, Michelle. There are a couple questions regarding a potential chlorine shortage and what will it do with an increase in outbreaks because of it, and if there are any recommendations you have for pool operators.
Let me take this one. This is Dewey with CMAHC. So just so everyone knows, the chlorine shortage that is being referred to is particularly focused on the isocyanurics, your trichlor and your dichlor. These are going to be most commonly found being used at your smaller HOA type facilities, hotel, motels, apartment complexes, those type pools. That's where we're going to see the biggest impact, as well as residential, and with this shortage. What is occurring is that some facilities are having to look at switching over sanitizers, going into either a calcium hypochlorite type product or a sodium hypochlorite type product. You know, the big thing is, regardless of what sanitizer you're using, if you're maintaining a minimum free chlorine, then, and the other practices are well and good, then, you know, the risk of outbreaks, you know, apart from Cryptosporidium, E. coli, and et cetera, will be relatively low. The problem is going to be with some of these other products when we switch over to sodium hypochlorite or to calcium hypochlorite is, for most outdoor venues, you're still going to have to add manually cyanuric acid to maintain a minimum chlorine level, or the owner operator is likely just to exponentially go through more chlorine. So the biggest concern there is going to be primarily closures from little or no chlorine. So I guess theoretically, yes, we could see an increased risk of outbreaks from diseases from these low chlorine levels that come with using these other products that aren't necessarily stabilized. Or another concern is if the feed systems for the calcium hypochlorite or sodium hypochlorite products are not substantial enough to keep up with chlorine demand. So those are kind of the big concerns.
Yeah, I think it should be noted too in CMAHC's Model Aquatic Health Code, the lack of disinfection, residual chlorine in your water is a prompt for an immediate health hazard and an immediate closure. So in theory, if you don't have your adequate disinfection present in your water, you shouldn't be operating. So the risk would be if a pool is being operated anyway, even though they're unable to maintain their chlorine levels.
Correct. And one change, and I'll just talk to the change, and you know, there's a big process to go through CDC, but one change request that was for the 4th edition that was approved by CMAHC membership was the requirement for an operator to self-close for imminent health hazards, which would be zero chlorine or too low chlorine. You know, so that does exist inside the MAC, or will exist for the 4th edition.
Thank you so much. Our next question, and this might be to you, Michelle, but for others from CDC as well, I was very interesting to hear as you talk about the reporting of the outbreaks, and as we have a lot of pool operators and others and public health officials on the call, do you have any recommendations of how to better report that data? What those who are actually filling out those and reporting that information, how that can be made it easier for you, for I guess in your slide later on, as you're looking at reviewing that data and collecting that information, any kind of lessons learned from putting together and going through the data of this MMWR?
Oh, I love that question, and it's one that comes up every time we consult on an outbreak investigation here at CDC. It's where is your environmental health practitioner? You know, I think, us EPIs, we're good at telling you who got sick and when and where, but it's really the environmental health practitioners that are telling us the why. Why are people getting sick? What happened? What are the contributing factors? So I know on our end, on the EPI end, because I interact more so with epidemiologists and environmental health practitioners, I'm always encouraging them to talk to their waterborne, I'm always encouraging the epidemiologists to talk to their environmental health colleagues in the pool programs and if applicable in parks and recs for lakes. We do, just like Dewey was asking for a list or suggestions for people in individual states to sit on the state designee committee, and that in my understanding is mostly environmental health practitioners. We here at CDC maintain a list of waterborne disease coordinators, mostly our epidemiologists in our state. So I'd be happy to connect you with your with who's probably going to be at least looking at the reports that come here to CDC. If that would be helpful, I'm more than happy to share names and connect the epidemiologists and the environmental health specialists. Joe, do you want to add anything to that?
No, you hit it on the head there. Lots of times to tell the whole story and to figure out the solution to the problem, you need to look at it from all of the angles. We have a three-tiered approach a lot in public health of lab, epi, and environmental health, and together they could tell a pretty good story.
Awesome. And we have one more question right now. And Samaria, thank you for answering this through the Q&A box. But just so people can hear your answer to, how can biofilm be removed or destroyed? This was a suggestion for Legionella control.
Yes, I think I may have misread it. I see that it says how. And I was answering that, yes, it can grow back. So when removing biofilm, it's important that you maintain the proper free chlorine and concentrations in the pool as well, or the water facility or water venue, excuse me, I'm forgetting my words. That you also just vigorously scrub the surfaces, make sure it's cleaned properly, and that you also do change the water as necessary. But like I said, these are all specified further in the Legionella control kit and the water management program toolkits. But does anyone else have more information on that?
Yeah, and Legionella is a very susceptible bacteria. It's pretty easy to kill, and it's usually not a problem if you're able to maintain your residual chlorine levels. But one of the best ways to get rid of that biofilm is to mechanically remove it by scrubbing. And use your hands and a brush and scrub it off of there with a proper disinfectant as well, a cleaner that's going to assist you in that. I didn't want to take
Joe, just piggybacking off that for a second. And I'll pose this question to you on their behalf. Because a lot of times when we talk about plumbing and all that, right, I think a big question becomes, what about the biofilm that we can't reach? Biofilm has, and correct me if I'm wrong, but biofilm does have a certain level where it becomes less susceptible to chlorine. Do you remember what that level is off the top of your head?
No, I do not. But you're right. It's pretty tough to scrub biofilm that's present inside pipes. Particularly drinking water pipes. If to go a little bit off topic here, but all of our municipal drinking water distribution lines and service lines probably do have some kind of biofilm on the inside, and our water pressure keeps the force pushing the outside of the pipe, and it keeps that biofilm in place. So if we have a loss in pressure, on the inside of those pipes and there's a service disruption, the biofilm can slough off because it doesn't have that pressure holding it up against the inside of the pipe, and it can become a problem. Yeah, that's a good question, dude.
I do think one thing we have found is, you know, we talk about chlorine and chlorine not being very effective against biofilm, and you know, Joe pointed out that, you know, the water puts pressure on it and kind of keeps it where it is. We know when we use chlorine, the chlorine just burns off. It's just degraded, or the chlorine level is depleted, you can say, because it's oxidizing that biofilm. It's not getting anywhere. We have seen when we look at biofilm in more of a drinking water setting, and let's say like a healthcare facility, we have seen when we use chloraminated water or chloramines, we're actually better able to manage the Legionella because it's not as an effective disinfectant. It's not as potent. It's not as reactive. So it's able to penetrate the biofilm and not be spent and go and get at Legionella.
Well, thank you, everyone. We have one more question here, which I think's a great question, and I would love to hear from our panelists because I think the Model Aquatic Health Code has a lot to share with us on this, but it's a question regarding physical safety standpoint. So looking at guidance regarding ensuring that the pool is secure. So for example, fencing and potential liability to owners that need to follow. So yes, I'll leave it open to the panelists to address that.
Yeah, this is Dewey again. The easy answer is yes. When we look at the MAC, it does have requirements for barriers and enclosures to prevent unwanted access.
Right, and a lot of that is centered around safety and not letting unauthorized people enter when they're not supposed to be. Thinking particularly of children and people that are unable to swim and there not being any supervision at the pool becomes a serious drowning hazard. And the MAC, keep in mind, is for public venues. So it doesn't apply as easily to backyard pools, but there are during building and construction of backyard pools some guidelines that need to be followed per your local and state building codes. And I think most of those do require a fence around your yard to prevent unauthorized entry. Mostly so kids can't sneak in there and drown.
Well, thank you so much, everyone. I don't see any additional questions here in our Q&A box. So I just want to close by really thanking all our speakers for joining today, for going through and answering the great questions that we had. I would really recommend for everyone, our attendees, to join our Model Aquatic Health Network. We do host these webinars. And we have several webinars that have already been recorded that you can access there. And you can also sign up and subscribe to receive information about upcoming webinars. With that, this closes today's webinar. Thank you so much for our CDC's and CMAHC speakers. And we'll look forward to seeing all of you in our next webinar. Have a great day and healthy and safety swimming week. Bye, everyone.